tonight. And I think what I'm going to do tonight is we'll do another, and I don't know if many of you have been with me for these past sessions, but I like to keep it simple because sometimes, people are sort of new to this practice, or, you may be also a mindfulness practitioner or a meditation practitioner, someone who does this a lot, in which case that's okay too, because technically we're supposed to come to this practice with a little bit of a sense of newness and curiosity each time. So it's okay either way. Um, I would encourage you, because this is the last session in this series, just to think about ways, if you've attended some of the other sessions, to think about how you can maybe incorporate a regular practice into your routine or your life. It could be something short, or, if you're busy like most of us are, maybe think about just how you can incorporate a practice into your day. Dr. Wells, when she had her presentation with us in August, she talked about how did she manage, or, when we're talking about if you're going to prescribe a meditation practice or a mindfulness practice and you're really busy, or, how much time should be allotted each week. The idea of making this a part of your life where you're able to be in the moment as much as possible should really help, and help you be present where you are and in your physical experience there, here and now, versus thinking about things that are going to come or things that happened in the past. So when you think about, just doing any sort of activity, whether it's going for a walk or doing your dishes or eating your breakfast, feeding your children, to really just be present for that moment and be where you are. You don't have to be thinking about anything else, but being present in that moment can help with that sort of mind, what we call sort of monkey mind, where it's busy, busy all the time and thinking about a lot of different things. If we're able to be present, it can really help reduce stress, and reduce those stress levels, which can help relax everything and tension in the body, and help with just coping and also responses and pain levels in general. And then it's also, I think, just helpful for health and well-being in general too. So I just want everybody to come to a really comfortable seated position, and make sure you're sitting up and not straining anywhere. If you feel like there's a lot of strain, or it's very hard for you to be in a seated position, then I welcome you, if you want to lie down on the floor or on a kind of nice sturdy couch or bed somewhere, where your body feels supported and comfortable, then please, by all means, go ahead and do that. Sometimes people like to lie down and they put a pillow or something under their knees, but if you're okay sitting up, then that's just fine for this practice today. And just make sure that you are sitting with your feet nice and flat on the floor, so you feel the ground beneath your feet nice and even, and that underneath your buttocks or your sitting bones or your thighs are supported by the whole chair, and you're able to just sit straight, rising up through your spine, with your head just nice and balanced on your body. And your hands can be wherever you feel like they're comfortable. Sometimes laying in your lap is nice. They could be facing up or facing down or by your side, just somewhere where you're not sort of holding or, tightening, and there's room around them to relax. And we can go ahead and gently close the eyes now. Sometimes that helps with going inwards and just being present in your body. If this makes you dizzy or you don't feel good with your eyes closed, then please, by all means, leave them open. But if you're able to gently close them from top to bottom without tightening or holding in your eyes and letting the muscles and the skin around your eyes just relax, that would be wonderful. And we're going to start with some deep breaths, just taking a nice slow breath in through your nose and filling up your belly. So bring it deep into your belly and let it expand as much as comfortable as is comfortable for you, and then let it go gently through your mouth. And then take another deep breath in through your nose and kind of feel the breath, focus it going in through your nose and down into your lungs, and your belly expanding as your lungs expand. And then once your lungs have filled and it feels right to let go, just let it go through your mouth. And you can take another couple of deep breaths here. Just easy. You don't have to count or force it. Just slowly in and out. And as you're taking these deep breaths, try and just come and be in your body where you are right now. If you can let go of the things that happened during the day, let go of the things around you that might be distracting. Let go also maybe of the noise that's kind of seemingly constantly around us now with, you know, all of the media and social media and news and events happening all around us, some of which can be pretty distressing. You let go of those and just be where you are, be in your body, and let be with yourself in your body right at this moment. And you can continue to take some nice, slow, deep breaths. If there's something in your mind or noises around that distract your mind away from the breath, that's okay. You can just acknowledge that it's happening. And then you can just bring your attention gently back to the breath. And letting go can also be about letting go of any sort of emotions or tightness or feelings that you're having too. So, not just things thinking about things that happened or your to do lists or events of the day, but it could also just be feelings or, um, worry. See if you can also put that aside for a little bit now and just focus on the breathing. Coming in through your nose, getting warmed by the nasal passages and going into the lungs, feeling the lungs, filling your body with the oxygen, letting it circulate around your body, and then let it go. And then all you have to do next is do it again. Take another deep breath. Let it fill your lungs and fill your body. And then let it go. So we're going to start with the body scan, which is just noticing how different areas of your body are feeling. And if something is maybe tight or tense or even painful, if we can acknowledge those areas, maybe release or let go a little bit in those areas, release some muscle tension, and then move on to another area of the body. And in this way, really check in with your body to see where is it right now and be accepting of wherever your body is at and feeling right now. And you might notice both, maybe there's areas that are tight or tense in your body. Maybe you notice something is uncomfortable, or maybe you notice some temperature or things feeling warm or cool. Is there anything, touching different areas of your body? Like, are there maybe some warm socks on your feet and the sensation of that? And we'll go ahead and start with our feet first. And can you feel the sensation of your feet into the ground? Let your feet just rest and be held by the earth. You don't have to press or force anything. Just feel the weight of your feet on the earth. Are your feet, tense? Are you able to relax the joints in your feet, the muscles in your feet? Are they cold? Are they warm? Just bring your attention there. And if your attention wanders as we do the body scan again, you can just acknowledge and say, okay, that's happening. And we can come back to what we're doing, which is just focusing on being present in your body and taking notice of how each part of your body is feeling and doing right now. And maybe letting those parts relax and just ease and be. So we're going to move up from the feet into the ankles and then up into the shins and the lower legs. Are there, it's getting cooler in some areas of the country now. Do you have pants on? Can you feel the edge of your pants or your socks in the place on your skin, on your body there? Again, are there areas that feel cool or warm? As you're breathing through this exercise, can you breathe and then send breath through your body all the way down through those legs, through your toes and your feet? Is there any tension or tightness in your calves? Focus on maybe different areas around your lower leg, seeing if you can breathe and then send the attention there. And maybe let go a little more. And with another deep breath, we can bring the attention to the knees. Are they feeling okay, comfortable? Maybe there's some discomfort or pain in the knee joints. Can we just be with what we're feeling right now in the legs, in the knees? And if you feel sometimes like maybe the mind is wandering or you need to bring it back, that's okay. It's also okay to do that with a kindness and a gentleness towards yourself. If there are distractions or you feel like, you know, it's difficult to focus or there's other things drawing your attention away, just acknowledge that. And then you can return to where you are. And with a curiosity, you can continue to check in with yourself. How are your lower legs or your upper legs now we're moving into? How are they feeling? And can you, while you're sitting and you're supported in the chair, sort of melt those upper legs and the bottom of your thighs into the chair and just feel it supporting your body, supporting your weight gently. You don't have to do much because the chair is holding you. Can you let yourself be held? Feel the areas where your body is contacting the chair. When you take the deep breath, send the attention and the awareness there. And we can move from there to the base of the spine and the buttocks where again, we're holding ourselves and the chair is holding us and we're letting ourselves Just be supported by the chair and acknowledge, if there maybe is some discomfort or possibly pain in the lower back. That's where a lot of tension and sometimes discomfort can be. If you need to shift a little bit or move because that's what your body needs in terms of the comfort, that's okay. Try not to fidget too much. You try to bring that attention back. But if you need to make any adjustments, of course, that's okay in order for you to just be here and be present in that area and bringing attention to that area of the body. And we can work our way around to the lower abdomen and the pelvis. And take a moment here again to really focus and feel the breathing coming in through your mouth or your nose, filling your lungs and then expanding the belly with that breath and letting it out gently. And again, releasing the breath. And are you able to release some of the tension that might be held there? Sometimes there's emotions that are kind of held in the abdominal area, and can we just be with those and also just let go? And before we move up to the upper chest and the shoulders, let's turn our attention to our hands and our fingers. Our hands that do so much for everything, for people around us, people we are taking care of, for ourselves. If you have them either hands up or hands down in your lap, can you focus your breath and attention on the fingers and let the muscles around the bones and the joints just relax and melt into your thighs. Just let them be supported. They don't have to work now. They are just there, being held. And can you notice, is there any discomfort in any area in your hand? It may not be. And if there is, though, you can just acknowledge that's what you're feeling right now. And with a nice deep breath, bring your attention to your wrists and then your upper or your lower arm connected to your wrists. Can you let the muscles around from the elbow extending all the way to your wrist? Can you let things go a little bit? Let the muscles go. Again, letting the hands be held by the thighs there and wherever they're resting. You feel the sensation of any sort of cloth or shirt you're wearing on your arms. As you move your attention up to your upper arms, let the muscles relax around your upper arms. And the muscles that extend into your shoulders, and then your upper back. Can you relax your shoulders down without slumping, but we're holding ourselves just gently upright? Can those shoulders relax just a little more? Can you let go just a little more in those shoulders and release them so that they're not tense and tight and hovering, sort of closing in on your neck like that? Can we just let them go? Feel what that feels like to just let them release. Take a nice deep breath and send that air, the oxygen into your lungs, and also send the attention then with that air into that upper back and the shoulders. And then when we take another deep breath in through your nose, fill up the chest and the lungs with the air and your belly. Now really focus your attention on your chest and the center of your chest. This is really, so there's some emotion we can hold down low, and then a lot of emotion and tension can be held in the middle of the chest there, around the heart area, of course, but sometimes just that upper chest, sternum. There can be a lot of tightness there, even though we're maybe not consciously sort of holding. But sometimes we do hold the breath or tighten the breath and forget to breathe and let the oxygen in and fill our lungs completely. The oxygen that helps nourish our body. Let that air fill your chest there again. Circle around your lungs and then gently let go, let the air go. This is a great place to show yourself some kindness and compassion, and just be where you are. To turn that loving kindness on yourself that we often give away very freely to everybody else. Can you give it to yourself now? And while you're breathing into your chest, really feel that compassion towards yourself and kindness. Feeling you are enough. Letting yourself know just where you are right now. This is enough. And in your next inhalation, let your attention move up towards your throat. You can go ahead and swallow here. And with that swallowing, can you then release some tension that you hold in your throat and just notice if there is any tension in your throat. And around the back of your neck, is there tension there that's holding or pulling? And can you just let your head sit nicely on the top of your spine without holding too much or creating tension? Can it just be there? Can you release down into those shoulders, the muscles? Notice how that feels. And if there is tension, you can notice that too. And if you can let it go just a little bit. And if you can't, or if it feels like the opposite is happening, where you're bringing attention and that's maybe causing more of a tightening or more of a forced action, then maybe just can go back and focus on your breath and see if you can just say, okay, that is just what's going on right now, and not force it too much if you're having a hard time releasing. And the muscles that are in the neck, connect and run up into the back of the skull and the head. And then there's also muscles then that connect into our jaw. If you swallow, are you able to let go of the muscles around the jaw and let it just be relaxed? You don't have to let it hang open. Sometimes letting your tongue gently rest on the roof of your mouth can be helpful to let go of the jaw. Gently having a place there for your tongue and taking a deep breath in, filling your lungs and letting your attention go to that lower jaw and your tongue and your mouth and feeling the sensations there. Seeing if maybe this area can relax a little bit more. And then focusing attention now again on the eyes and the skin on your forehead and the muscles that encircle and are around your eyes. There's a lot of muscle actions and muscles here in the face, around the eyes, in the cheeks. Can you notice how they're feeling right now? And see if you can release and let it go and not hold or tighten. Just have the eyelids resting, taking deep breaths in Releasing the skin of the forehead down. Taking deep breaths in, and as you breathe out, release that skin of the forehead down again. And bring attention to your ears, the skin around your ears. The sensations you might be feeling there. The sounds. There are sounds in the background. Let them come in. You can acknowledge them and then let them go. And bring the focus back to the breath and to seeing if you can relax the skin and the muscles around the ears and the head and the back of the head now. Can you bring attention there? Are there any sensations of tightness, of pain maybe? Can you acknowledge whatever it is that you're feeling there? Notice are things feeling tighter on one side of your head or neck versus the other? Can you release those muscles that run up the back of your neck into your lower skull? And just take a moment to take a nice deep breath. Let it fill your belly and then let it go. Another deep breath, showing yourself and your heart and your body kindness and acceptance wherever it is right now. And just let it go. Let the breath go. And as we take another deep breath, you can maybe start to wiggle your toes just a little bit. Feel the sensation of your toes in the ground. Maybe stretch them a little bit. Lift them in your feet a little bit off the ground. You can move your ankle around on one side and then the other. And your fingers can start to move now a little bit. You can wiggle them gently. Move your hands gently. And another nice deep breath in. And notice the effects of this practice in your body. Did something change? Do you feel more present being in yourself, in your body, or not? And just being with that sensation for right now. And go ahead and gently open your eyes. And come back to where you are, noticing your surroundings and coming back to being with the group here. Taking a nice deep breath in and letting it out. And we can gently join each other again. And I'm happy to answer any questions or welcome any sort of thoughts or observations if you have them.
Annika, thank you very much. As always, such a restorative session. We encourage you, if you have some comments, to put them in the chat box. If you have any questions for Annika, she would answer them now. So please feel free to write in your chat box. We're happy to see all of you take special care and add this self-care to your treatment plan, and want you to know that this recording will be on our YouTube channel, the Miles for Migraine channel, so you can, as Annika suggested and Dr. Wells suggested in our August series, that you make it a part of your daily routine. We have these sessions for you to play at your convenience so that you can re-experience what you felt this evening, and we encourage you to do so. It's the youtube.com Miles for Migraine channel. You can subscribe, but if anyone has any comments or thoughts, please put them here. Getting lots of thanks and feel good about relaxing.
Thank you. Thank you everyone for being here tonight. It's really, it's been really special, during this time with the pandemic and everything going on, to be able to connect with people from all over and have these sessions. So thank you, Helen, and the Miles for Migraine community for doing this. It's really nice.
Oh, we're grateful to have you be a part of it. That's why we offer it, because we feel it's so important that self-care should be a part of all of your treatment plans. I'll just type in here. If you search YouTube, Miles for Migraine, you'll find our channel that has our education series as well as our mindfulness series. So you can pick various sessions and replay them as often as you like. We'll also have them available on our website. So thank you all of you for coming this evening.
Oh, there's one question. I don't know, Helen, if I can address it, but I'm happy to. Just talking about emotions. So I think, it's certainly very normal to, when you're noticing what's going on in your body, to have a surge of emotions. And I often, not necessarily with meditation, but with yoga practice, can feel, for some reason, it's like all of a sudden awakens or releases those emotions. I would just really take time to notice what's happening. So it's all about acknowledging what's happening with yourself in that moment and letting yourself have that time to acknowledge those emotions, that you have those. If it's something that's really disturbing to you and that's bringing up a lot of stuff that maybe this is not the right practice, but I think it's okay to kind of be where you are and acknowledge your emotions. I encourage you to do so, and maybe just take some time right now to kind of be there and be with that and yourself if you can. And it might be helpful just to continue practicing if you feel comfortable and okay with that, to be with those emotions. I think that's probably a good thing in the long run. Thank you. Oh, sorry, Helen, you're muted, I think. But thank you, everyone. Thank you so much.
That's good advice to, that's part of what mindfulness does, is to put you in the moment, to recognize it and use these sessions to work through it and maybe replay it again to see how you feel the next time.
Okay.
Enjoy your evening, everyone. Thank you.
Thank you so much.